how to use ESSE's rapid assessment framework for vulnerable children exposed to adversity associated with poverty in primary care settings. Evidence suggests that people with low socioeconomic status, such as vulnerable children, are less likely to access primary care. As a result, due to their exposure to ESSES, they are at higher risk of poor health outcomes, including premature death. The problem is, most of these children are not identified and missed out. This is due to healthcare disparities, including lack of formal integration by psychosocial measures in primary care settings. The key domains of ESSES due to inadequate resources can be caused by adversity related to food insecurity, which can result to diseases such as malnutrition. Others include drug addiction, neglection, abandonment, and school dropout. For instance, according to the 2018 Tanzania National Nutrition Survey, using SMART methodology conducted by multi-stakeholders between Ministry of Health and Tanzania Food and Nutrition Center for Tanzania and Zanzibar, indicated that chronic malnutrition is increasing when a child is at age of 27 months by 45.2%, as indicated in the graph. The problem of drug addiction and school dropout have decreased in the past 7 years due to various measures to combat childhood pregnancy and poverty eradication. According to a report from the Ministry of Education, Science and Technology in collaboration with UNICEF Tanzania, it is indicated that there has been a dropping of number of children who are dropping out from school. This was from 6.6% in male children to 5.3% in female children in year 2014, to a drop of 3.8% in male to 3% in female in year 2016. However, due to structural factors associated with the poverty, such as walking a long distance, is still a challenge in rural areas. A child who is not attending school is at higher risk of conducting childhood labor activities, which expose them to adversities. The challenge is, how can we identify these signs earlier so that we can prevent them before the child is already impacted by irreversible conditions? In our study, by involving experts, the healthcare professionals, we have developed ESSE's rapid assessment framework to activate identification and formal integration of biopsychosocial measures for vulnerable and homeless children exposed to health. This framework is to be used by frontline healthcare professionals in primary care settings. The purpose of the framework is to enhance rapid identification of the children with health risk due to adversity related to poverty, through clinical observation without any physical contact with the child. The ESSE's rapid assessment framework is comprised of 2 elements, which are implemented in 5 key steps. The first element involves implementation of biomedical mode of care through identification and management of the exposed vulnerable children using the 7 early warning indicators. The second element involves integration of biopsychosocial measures through referral pathways. These early warning indicators include often alone child, unkept, a child who is poorly groomed, possibly running nose and neglected, stunted growth, swelling of the body parts or edema, skin abnormalities such as rashes, wounds, injuries, injection marks, and puffiness, fatigue, lack of energy for a child to play and associated with age-related activities, drowsiness, a state of being sleepy. The process of identification and establishment of referral pathway of a child exposed to ESSES within primary care using ESSE's rapid assess framework involves 5 key steps. During identification process, the 4 steps of ESE's rapid assessment framework will be used, whereby during establishment of referral pathway, only 1 step will be involved in the process. Step 1. Respond immediately to the primary head-to-toe assessment of a child to establish a patent airway, adequate breathing to sustain life, and blood circulation to ensure normality. Step 2. Assess for a secondary head-to-toe assessment using the early warning indicator signs from ESE's rapid assessment framework. The early warning indicator signs have been developed cumulatively to identify the severity of the ESE's exposure. The more the early indicators signs, the severe is the child exposed to ESE's. These early warning indicators are within ESE's rapid assessment framework scale. The scale range within the ESE's rapid assessment framework are divided in 3 parts. The first range is from 1 to 2, which is considered as the child is mildly exposed to ESE's and has been identified by color green. The second range is from 3 to 4, which is considered as the child is moderately exposed to ESE's and has been identified by color orange. Lastly is the third range, from 5 to 7, which is considered as the child is exposed to severely ESE's and is identified by color red. Most importantly, the cutoff of marker of implementation should start from range 1 to 2, even when a child is considered to be mildly exposed. Step 3 involves provision of immediate protection as required, as covering open bleeding wounds, offer food, or wrap a child with warm clothing. Step 4 involves intervention, long-term biopsychosocial medical care as needed. The second element involves establishment of 2-way referral pathway within primary care settings and in the communities to stakeholders for social support services. This is achieved through the 5th step of the framework in case the child requires further social management or intervention not available at the source of identification, as identified in the 5th step of ESE's rapid assessment framework. Step 5, determine referral through interdisciplinary team and community stakeholders.